Hi, I'm Dr. David Sneed. Welcome to Austin Family Medicine Associates. I'd like to talk to you about allergies today. Now, we think in Austin that we know everything about allergies because it's ground zero for cedar pollen. Cedar fever is probably one of the most largely affecting disease processes in this county and region, and everybody that comes in with any kind of a sniffle always thinks that they have cedar fever, even if it's not cedar season. This is a very common issue and one that's worth talking about today. So what about allergies? Do you have them? It's likely that you do to some degree or another. So how do you know if you have allergy problems? Well, if they're mild allergies, you'll be sniffing and sneezing, and your localized symptoms might be just an itchy eyes and runny nose, maybe a little cough or something like that. If you have moderate symptoms, they may actually spread to other areas. You might have symptoms in your nose and eyes and throat. Maybe asthma has flared up, and maybe you've got some skin problems to boot. But what a lot of people don't know is that allergies are really serious business. They're the sixth leading cause of chronic illness in the United States. They're worth treating, and they're worth investigating what you're allergic to. If you have allergies, it's likely that other people in your family do also. So if you're a parent with allergies, your kids probably have some allergy problems. And it's likely that you got them from your parents. So how do we test for this? There's various ways that we can evaluate it. And it's not just inhaled allergens, but those are the ones we think about the most. We can do skin tests in our office. This is where we carefully apply small amounts of the allergen to your back and see what develops. The other ways that we do testing is with blood testing. We can check for allergies with your blood. We can also check for food allergies with your blood. Now, there's not much you can do about food allergies except to avoid those foods, so it's very important that you find out what it is you're allergic to. One of the other ways that we can do testing for allergies is to look for contact allergy problems. These are chemicals and substances that are in our environment that cause our skin to react and cause rashes and itching and welts on our skin. So it's very important that we look for those things, and we do careful patch testing here in the office. It's very effective at identifying what you need to avoid. While we're talking about allergies, I also want to talk to you about chemical sensitivity. And this is oftentimes mistaken for allergic problems. But what it really is instead of an immediate reaction to a chemical or an allergen, it's a delayed response that can cause actually some chronic illness problems with chronic fatigue, fibromyalgia, migraine headaches, skin problems, asthma. Even depression can be caused by these allergies that are really hypersensitivity to chemicals in our environment. And we do a special test called the ALLCAT test, which measures these out of your blood. So what we're doing is measuring sensitivities in your lymphocytes, your white blood cells, to about 200 different common foods and chemicals that are in the environment so that you can identify them and avoid them. In many cases, we find that you're not having too many problems, but there are specific foods that you need to completely avoid, and then later maybe bring back into your diet in a rotational fashion. We can give you very specific information to help you improve your health through this diagnostic technique. So don't despair if you have allergies, but also don't think that everything is an allergy. We would love to help you with these problems and have many ways of testing for and treating your specific allergic problems. Thank you.